Good evening. Ring a Doc EHR, Doctor Patient Communication Simplified. The future of health is in your smartphone. Ring a Doc was founded in 2010 by Jordan Michaels, former medical student who was seeking more humanitarian view for healthcare after finishing the pre-med rotation at LAC. It is currently known as Practice Fusion, but I will address it as Ring a Doc for ease of transition unless noted in citations. While there, he constantly saw a frustrating trend among physicians with too much unnecessary restrictions and not enough effective healthcare treatment due to insurance restrictions and long specialist wait times. This is known as a problem-solving barrier. In one instance, he describes witnessing a physician having to prescribe Tylenol to patients who suffered from chronic migraines instead of effective prescription of Imitrex. Because to prescribe Imitrex, it required an evaluation from a neurologist, which had a 4-month waiting list. He began to think there had to be a way to better remove the middleman from the equation and provide optimal direct patient-to-doctor care. Through analytical problem solving, Ring-A-Doc was created to provide an on-demand digital service through which patients can reach doctors at any time. By allowing physicians to chart and triage straight from their smartphones, it reduced the time wasted commuting back and forth from facilities and offices, thus having quicker access. By providing a flat rate for all services, physicians can limit the amount of outsourcing needed to monitor, file, and code patient visits, thus saving costs that would come from it and having a fast turnaround rate for physicians. Convenience. Convenience can come at a price. Let's remember that price when we're discussing the threats. Ring-A-Doc assists in responding to patients directly rather than requiring them to go through an operator, giving physicians the flexibility to answer calls on their schedule after hours, easily track patients' health data over time to monitor progress and identify potential gaps in care, providing natural language filtering and refinement suggestions. ICT-10 at their fingertips. It connects patients to doctors who speak the preferred language to remove communication barriers, while reducing the non-productive waiting periods. Remember those threats we discussed? Threats to current healthcare are the overall changes the organization structure of healthcare will see. No longer will physicians need to fill staff in order to run his practice. Large organizations can reduce the amount of overtime paid to nurses for charting, coding, and documenting, as the program has pre-designed templates to offer smooth transitions while monitoring for any errors. With technology in healthcare, we risk security breaches within our system. Currently, organization charts via desktops or workstations connected to organization security firewalls with IT monitoring. Once information is on a smartphone and outside those parameters, organizations are limited by how and when the information is accessed. More than 27 million Android devices with medical applications on them also potentially have at least one high-risk malware. Yet 65% of doctors share patient data via SMS, text messages, and 33% via WhatsApp. 14% of those do not have password protection on their phone. Job replacement. Ring-A-Doc describes savings that are primarily attributed to automated, several time-consuming, paper-driven, and labor-intensive tasks. In other words, cutting the cost of hired personnel and limiting the already stressed-out job market. Misdiagnosis, insurance rate increase, and liability. Virtual doctors limit the opportunity of check and balance as face-to-face communication is decreased. For example, a doctor takes a call in the middle of the night after working rounds in a hospital. Frantic, the patient is pushing through explaining the symptoms and past medical history. Although the symptom being experienced seems to be textbook flu symptoms, the doctor is unable to see the physical responses, such as hand tremors and restlessness the patient is experiencing. These are symptoms of alcohol withdrawal that are like the flu. Broad range of lab and pharmacy partners. Smart lab results that are instantly shareable. They receive results directly to the physician's EHR, giving structural results directly in patients' charts. Abnormal results are then flagged automatically to help identify the care needs. The patient-friendly monitoring system cuts down on follow-up calls and easily meets meaningful use measures by sharing results electronically via the free patient portal. Those results can easily be transferred and shared with other physicians. And they can log remotely anywhere to access the patient charts. Prescription monitoring. Physicians no longer need to physically fill prescription papers. They can send it directly to the pharmacy of the patient's choice. The pharmacy can then find coupons that will help save the patient money. The patient portal helps patients. They no longer need to wait online to know how long their prescription is going to be filled, thus freeing them to do other errands or return back to work. It also helps them see how long it will take to fill the prescriptions. Raising the bar. Ring-a-Doc promises to reduce patient dissatisfaction by providing less wait time to see a physician, whether it's gaining an appointment or waiting in the waiting room. With 24/7 patient access, they have direct answers to their questions, whether it's about medication they are on or treatment. Organizations will have access to a larger pool of physicians during the on-call hours. Physicians can log in remotely anywhere to access their charts. Having this remote access will reduce the use of the emergency room for non-urgent matters. Patients will feel more comfortable knowing their symptoms will be checked by a physician in real time, no matter what hour of the day. This will reduce the amount of overtime or overflow staffing organizations will need to pay out, thus reducing costs of the personnel. Streamlined billing and automatic coding, provided via pre-installed templates, ease the access to following up on billing. Global communication means communication among physicians are no longer limited via the organizational structure or dependent on patient providing their past records. There is no more waiting outside the office staff to properly transmit, send documents, lab results, or x-rays. Also, global communication offers peer-to-peer communication on problem solving involving the industry. Class 2013 ambulatory EMR performers reported that Practice Fusion to be the top value EHR for money's worth. Number 1 EHR for family practice, number 1 EHR for avoiding nickel and diming, number 1 EHR for proactive services, and number 1 for overall satisfaction. 94% surveyed providers plan to stick with Practice Fusion for the long term. According to the AJMC, patients at hospitals that use EHR software cost up to $730 less to treat patients than facilities who are not using EHR. Studies from the Society of Actuaries found that medical errors cost billions of dollars across the country, amounting to more than $19 million in 2008 alone. By also raising the bar, they have an easy access system where patients can go through their icons, thus leaving us to our conclusion of Ring-a-Doc provides service that is needed to move out of the current high-risk, low-cost healthcare mentality and focus on quality patient care and satisfaction for the new age clientele. Risk factors include transitions are not far from what is currently being experienced, breach of data information, and possible human error. Training physicians on how to properly secure information and the importance of passwords and non-personal use of professional work phones could reduce these risks. Ring-a-Doc is capable of solutions to our organizational budget needs, as it reduces the costs associated with proper paper management, increased workflow, and productivity. Its IC10 integrated system takes the burden off monitoring that we are ICD-10 compliant under HIPAA. Thank you, and I hope you enjoyed this presentation.